It's 5:15. I'd like to call this regular meeting to order. I'd like to recognize everybody in the audience tonight. And then would you please stand and recite the pledge with me? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to B, school board norms. Diane, would you like to read those?
Our school board norms: to share and respect varied opinions and speak with a united voice once a decision has been reached. To prudently prioritize resources in a student-centric manner that aligns with the district's strategic plan. To exhibit a mindset of continuous improvement through adequate preparation for meetings and a commitment to board education. To commit to assessing board effectiveness to ensure high-quality governance for the staff, students, and community of Jamestown.
Thank you, Diane. Any moving on to conflicts of interest? Any conflicts of interest to declare? None? No, we have nothing under public communications either. Moving to consent agenda. Motion to approve. Motion by Heidi. Seconded by Gail. Any discussion? Hearing none. Assuming. Oh, go ahead, Greg.
Well, yeah, I just had a question, and I don't know if it would be later, but I just wanted to get the numbers for the amount that have considered homeschool for this year as compared to last year.
Okay, go.
Greg, it's 60 this year, 45 last year. So an increase of 15.
Any other discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into our regular agenda, we'd like to, if it's all right with the board, move our board education up to this spot so they don't have to endure the whole meeting. So I'd like to call on James Valley Health, Robin Isler and Dan for their presentation.
Thank you for having me. I'm Robin Isler from Central Valley Health. And I have a letter that I presented to the board. I think that it was shared with you all, and I'd like to read that at this time. So Dr. Leck and members of the Jamestown Public School Board, Central Valley would like to thank the Jamestown Public Schools for their partnership during the COVID pandemic situation. So first off, I'd like to say that since the pandemic began in March, information about COVID-19 has continuously evolved. It has been a challenge of all of the community to understand and act on the information that changes daily, sometimes hourly. We do know that COVID-19 is a novel virus, meaning it's new with no natural immunity. Because there is no vaccine or known treatments at the time COVID began, activities to prevent the spread of the disease continue to be the best defense we have to eliminate death. Prevention activities are shown to be effective for COVID-19 include, and we're well familiar with these, social distancing, washing your hands, wearing masks, and staying home when you're sick, along with the robust isolation and quarantine measures that are used to contain the spread. Currently, in Stutsman County, there are 548 individuals who have tested positive for COVID-19. There are 49 active cases and 4 deaths have been reported. The state percentage, the cumulative positivity rate, is currently at 9.6, and here in Stutsman County, it is 7.58%. We are listed on the statewide risk map as yellow. The target number where we'd like to be as a community would be at 5%. When we explore the number of positive cases in our community over the past 14 days, we do see that a spike occurred prior to and right during the start of school in Stutsman County. As we watch the numbers in the community over the past 14-day time frame, we notice that that average is showing a significant drop in the positivity rate. We attribute the increase back when school started to several things, including a large group gathering, some university testing, and testing at a large congregate facility. We are encouraged to see the drop in the past 14 days of the positivity rate, and we attribute that drop to the community prevention measures, which are those things that we are well knowledgeable about. And also, we have this good community contact trace investigations going on. However, our numbers statewide do continue to rise. Prior to school beginning, Central Valley worked with the county schools on plans, the North Dakota Smart Restart Guidance. Today, we continue to work with the schools on follow-up of positive cases, identifying close contacts, answering questions from parents on COVID-19, providing guidance to students who may be ill, and providing on-site vaccinations for the flu and other required school vaccinations. It is encouraging that the number of positive students in K through 12 in Stutsman County remains low. And with me today is Deb Fisher, who is our school nurse that's been working with the schools in helping with contact tracing and answering questions. So where do we go next? Well, there is hope that a COVID vaccine will arrive this fall. This vaccine will be available to healthcare providers and first responders. The vaccine will be beneficial in slowing the spread in the community. However, the vaccine will not be available for the general public or for schools until probably next year. Because vaccine is only a limited solution to preventing the spread of COVID, it is important that schools and the community continue to practice the prevention measures I mentioned. I encourage the Jamestown Public Schools to continue to monitor the current community positivity rate and also continue to follow their K-12 Smart Restart Learning Plan in order to foster the best possible learning environment during this pandemic. If the school changes to a more face-to-face learning, prevention measures such as wearing masks, social distancing, limiting interactions, washing your hands, and encouraging people to stay home will be necessary in order to keep the students and, more importantly, the staff healthy and free from disease. So thank you for giving me this opportunity. I would have, if you have any questions, I'd be happy to try to answer them.
Oh. Melissa?
And I apologize, you may have said this, but I didn't hear do you guys have a breakout of how many of the COVID cases in this county are elementary, how many are middle school, high school, and how many are adult? Do you have a breakdown of that at all?
So if you go to the North Dakota Department of Health's website, there is a dashboard. You can pick Stutsman County, and it'll give you the age breakout on that website. Unfortunately, because of our small numbers, a lot of times identifying data about Jamestown Public Schools is not available because they can be easily identified. So, but that gives you a good age range there, and really the 20 to 30-year-olds is our highest percentage of people who are positive in our county. Mm-hmm.
Any other questions for Robin? Rob?
I just have a comment. I want to thank Robin and Deb. I don't think people outside of maybe outside of this room recognize the amount of work that Robin and Deb do for the district, especially in our pandemic. Deb in particular, more recently has really been a godsend for our administrators doing contact tracing. She has taken over, in some cases, phone calls home to families, in some cases, contact tracing. She's been a very, very helpful individual for those that have to do the contact tracing, so we appreciate her very much. She allows us to do more of the instructional and management work that we need to do, and that has gotten much, much improved since Central Valley Health has allowed us to take some of Deb's time and devote it specifically to that. And Robin has been very, very helpful in the planning process as well, so thank you so much.
Thank you.
Aaron, you got a question?
So with the data that you have you seen, as a result of going back into the school setting, that driving any of the numbers in terms of positivity, either within the specific age groups or those associated with that?
So I think we can be very thankful that we have not seen huge increases in our student population by going back to school. I can tell you that there is a small local county school that did have to close for 14 days because they initially, at the beginning of school, had several positives. They're back in session now. Another school in Logan County had 44 students out about a week ago from learning because they were close contacts and they had their increased number of positives. So we've been very lucky to keep that at a low level, and I think that's because of some of the prevention measures that you're currently doing. So I appreciate that from the school and the parents and the community as well.
Diane? Oh, your mic, Diane.
Like many of us, I have brain freeze from too much news, but my understanding is about 5 days ago, the governor and his team waived the contacts quarantine period. And I wondered how, when you read your letter, it didn't address that, and I wondered how Stutzman County and the school district are going to follow suit with that, or if that's been resolved.
All right. So the first thing that happened is that the acting state health officer had put in a penalty for those people who did not quarantine when they were close contacts, and that was what was rescinded. So the guidance didn't change. It just rescinded a penalty that many people felt couldn't be enforced anyway. So that was what happened there. Now what they've done, as an incentive to wear masks, they have said that if you're a close contact to someone positive and you were both wearing masks, then you don't have to quarantine as that close contact. You still need to watch yourself, monitor for symptoms, things like that. But because both parties were wearing a mask, then you would not have to quarantine, and then you could continue to come to school. So I think part of that was as an incentive to have people wear masks. Mm-hmm.
Gail?
I have a question too. You alluded to if we go back into full-time, full students, how important would that distancing and what distancing would you recommend for those classrooms?
So that hasn't changed. It's still that 6-foot distance, and have people wear masks is still what's being recommended.
So do you think if that distance were only to be 3 feet, we would increase the risk then for our students and the staff?
Yes, I would have to say yes, because it's 6 feet is what we go by for contact tracing and what we go by for, and then it's that 15 minutes of time where I realize that but keeping the kids together in a pod, I think that's also important as well. Mm-hmm.
Any other questions? No? Okay. So if you want to go into your presentation.
So, yep, Dan is going to come up for the
Okay.
next speaker.
Perfect.
Mm-hmm.
Hi, my name is Dan Kramer. I'm the Regional Director at South Central Human Service Center, and I'm a psychologist there as well. Thank you for having me, first off. I was asked initially by Robin if I would come and speak with you folks here, and asked that with kind of the question about what are we seeing for mental health concerns with youth right now? And are we seeing an uptick in children struggling with mental health issues right now? And so, when she asked that question, nothing had been brought to me to suggest that we had been, that no one had come to me and saying, hey, we're seeing a lot of youth struggling right now. We're seeing youth in more crises right now. And so I had to go and look at what does our data tell us, right? So we do track everything we do, and we track like the type of services we provide and the type of requests that we get. And I know this question was asked to me earlier about COVID and how are people doing more broadly, not just youth, but people in general, the public. And we saw an uptick, especially kind of that May and June period where we saw an increase in substance use and an increase in people getting hospitalized. So there was this period, I think it was after kind of a few months of increased isolation, where you saw the struggle for folks. And they were folks that weren't reaching out before that. So it was kind of, I think, struggling alone, isolating alone, and then all of a sudden they were at crisis point. And so I did go and look then, like, okay, if we look just at people 18 and under, what are we seeing? Are we seeing a similar trend, or have we seen a similar trend? And again, remembering our role in the community is working more with those individuals that are in crisis, as well as, like, for youth, it's more the kids that have pre-existing anxiety and depression. So not just kind of your typical youth that's doing pretty well, adjusting pretty well. But when I looked, there wasn't the same trend that we saw with adults that we didn't see. So I looked at the data since March to prior to March, the average kind of number of contacts. And so the type of things you'd see would be kids that are expressing thoughts about suicide, right? Or kids that are engaging in self-harm behaviors, or kids that are using substances in a risky way, right? So those are the things we usually get called about. And so there wasn't an increase in those type of requests for us to come in and help for young people. And so then I looked again, well, what about since school started? Have we seen anything since then? And again, there was not. So I want to be careful because, right, those are just numbers, and the story is bigger than that. So I did talk to our counselors, and I got some just like anecdotal feedback, like, what are you guys seeing? And from that perspective, and again, these are individuals that working with kids that already probably have some depression, anxiety, or other issues they might struggle with, but they were seeing, we're seeing kids struggle a little bit more. And talked about the isolation from peers, having less peer contact has been hard. And then the other thing is the lack of structure at home. They've seen more of that. And so they've really had to work with families and parents about, like, in those times where you're not in school where you normally would be, how do we help build some of that structure that you would normally have that's beneficial for you, that's helpful for you? So that's been a lot of their work, is working with families and, like, trying to help those things that work well for you, how do we build that back in? So that's locally. And again, I think it's still early for us to kind of have a real good sense. But I did also look at kind of nationally, what are we seeing? And again, I think it's early to know, but there was one study that I thought was interesting where it surveyed kids, and it just said, how is your mental health now compared to before March? And 80% said it was worse. So that, I mean, that's a pretty large number. They said, like, I'm not doing as well as I was before. So there's something going on, right? And so I think it's important just to keep an eye on that and to be aware that our kids might be struggling a little bit more than what we see, and how do we pay attention to, and what can we do to help? And so that's what I wanted to talk to folks about, is, like, how do we notice? How do we, because, what would be kind of the warning signs, and what can we do to help? But first I wanted to comment on, there's a concept called resilience, and I've always been really interested in this idea of resilience. And what we know is kids are pretty darn resilient. Our young people are pretty darn resilient. In fact, more resilient than us as adults oftentimes, right? And so, like, when I was in grad school, they used to talk about resilience as, like, either you have it or you don't. Like, there are some people that are just born as being more resilient than other people. And so they tried to understand, like, why were they born more resilient than other people? And so kids that are able to kind of trauma, difficult things in their life, and really do pretty darn well through those things. And what they found, though, more recently, as they continue to study it and try to understand it, is that it's what you do and how you think and how you approach life that makes you resilient. And those are things we can teach, right? So it's not just you're resilient or you're not. And so I think that's really important for us as educators, as community, as parents, as family, to recognize there are things that we can help to foster and build in our young people to be more resilient, and even things that we can be doing better to model that. And one of the things, and it's pretty interesting. I mean, it's kind of a simple concept, but I think it's something as society we've gotten away from, is this idea that understanding that life can be hard, right? That there are good things in life, and there are bad things in life, and there's challenge and there's suffering. And it's kind of like they've noticed that people that are resilient have a different mindset about that than people that struggle. That they kind of, there's sort of an acceptance that I know that there are going to be bad days. I know that, and unfortunately it's kind of like, I know there's going to be bad years, right? But having that mindset helps people when bad things happen. It's like, I'm not being picked on, right? I'm not being targeted. This is part of life, and I'm going to work on it. I'm going to work to get through this. resilient people are also really good about choosing what to focus on. Okay? So I can sit and focus on all the things that are outside of my control and get frustrated and upset and anxious and depressed. Or I can choose to say, you know what, these are the things I can't control. These are the things I can. I'm going to turn my attention to the things I can control and put my energy there. Resilient people are remarkably good at that. And so, like, how do we, it's almost like the serenity prayer, right? You're going to focus on those things you can control, and that's what you're going to put your energy to. So, like, for us, again, I think as parents modeling that, right? Like, what are we choosing to pay attention to and talk about and focus on as a family? Like, what do we have control over? What can we do to make this better for us right now, for a family right now? And then the final thing that I want to talk about with resilience is that there's a question that people, and it's not always exactly this way, but there's kind of a thought process with, is what I'm doing or what I'm thinking helping me right now, or is it hurting me right now? Like, being able to ask yourself that question. Is the behavior I'm using right now, or the way I'm thinking about something right now, helping me or hurting me? And if it's helping me, let's keep doing it. Let's keep thinking in that way. If it's hurting me, maybe I don't keep doing that. And so I think, like, right now, an example of that, and I noticed I had to do this with myself, it's like the media. Like, I became really interested in the news with all this stuff and watching it and kind of, like, pouring into it. But eventually I kind of say, I don't think this is good for me to spend that much time paying attention to all this stuff. So you kind of have to ask yourself, is this good? Is this helping me right now? And if the answer is no, how do you turn away from that? So these are practical skills that I think all of us, and I think as parents and as a community, how do we model it? But then also being able to teach that. So that concept of resilience. And then the other thing I wanted to talk about, with mental health and with youth, one of the things in research I always talk about is almost always risk versus protective factors, right? I'm sure as educators, a lot of folks in here probably have heard that concept, right? So what risk factors are present and what protective factors are present. And so this is what made me, when all this stuff with COVID and youth happened, this is where I went right away was, I think most kids are going to be okay, right? I think most kids, again, people are resilient. There's going to be some tough times, but I think we're going to figure this out. The ones I worry about, so we talk about risk and protective factors. So risk factors, poverty, right? Housing instability, lack of access to good nutrition, lack of structure in the home. Maybe there's family stuff going on. Maybe parents are suddenly out of work. Like, when all those risk factors start to be present, then all of a sudden, all this stuff with these stressors becomes so much harder, and the potential impact becomes so much greater. So those are the ones I worry about, right? And so you also have protective factors like coping skills, like what I talked about, some of those skills we can teach. Connection, engagement, and community. And so, like, where you can have connection in a safe way, how to have it. Having structure and limits, rules, positive adult role model, physical and psychological safety. So, like, trying to offset risk factors with some of those protective factors. And I think that becomes our responsibility, right, as community. Like, how do we identify those kids that, because again, I think most kids are going to be okay. Not that this isn't hard, but most kids I think are going to be okay. It's the ones that have all those risk factors. Like, how do we identify those individuals and think about what are the protective factors that we can try to build up around them? So that, because that's when you might see the negative outcomes, right? When the risk factors become so great, and now you have these additional stressors. Like, that's what we don't want. So how do we work to identify those youth and then figure out, like, depending upon what the risk factors are, what are extra things we can do? What are extra things we can make sure that are there for them? Then, other specific risk factors, I just wanted to talk about it because we're here to talk about mental health. Kids that have mental health issues, even separate from all that's going on, right? So youth with depression, youth with anxiety, and other even ADHD right now can be difficult. So broadly, more likely to struggle with some of the online learning. Some, and even the lack of consistency might be hard for some of these youth. I think youth with anxiety, some of them might be super anxious about coming back to school just because of, like, the uncertainty of it. So as adults, like with these youth, validating concerns, not trying to minimize concerns, right? Acknowledging it, you hear it, remaining calm, modeling and teaching how to manage some of that, like some of that anxiety and some of that stress and some of that depression when it comes up. And then also being open to getting help for those youth. Mood disorders, I think we worry about our depressed kids because we know depression leads to isolation, right? Like depressed kids are more likely to isolate, and isolation makes depression worse. So again, being aware, again, as parents, even teaching the kids, like, when you start to, like, what are the things you start to do when you're not well? How do you recognize for yourself? And then how, as a parent, can I help kind of recognize those things and work with you on those things as well? So being aware of that. And then I just want to talk real quickly, this is the last thing, about general strategies to help. I think establishing and maintaining good routines for all of us, but for kids especially. So like even on days you're going to school Monday, Tuesday, so I come here as a psychologist and director, but I also have 5 kids in the school system here, you know. So I see the struggle from that side, but the importance of, like, we still have our bedtimes during the week, right? They're still at the same time. We still have the same meal times. We still have structured time where we're going to sit down and your cell phones, you're not going to be on social media and TikTok or whatever it is the kids are doing. But maintaining and encouraging and supporting that consistency. Healthy lifestyle, exercise, hygiene, you're getting up and you're showering. Like for me, I had one of my kids got tested, so I worked from home for a week. Really easy just to wear pajamas all day, but that's probably not the best thing, right? You get up, you get dressed, you do those things that help you feel good and help you be well. Consistent sleep schedule, get outside. And then when you're not well, don't be afraid to ask for help. Right now, like, the telehealth stuff is there's so much available resource for help. So you can go in and see somebody, or there's option to see somebody, through telehealth. And so there's really no wait times. So there's option to get help right away. And then finally, I wanted to point out to people that there's really good resources on parentslead.org, right? Great resources on COVID for parents, for families. So I wanted to point those things out too. So those are the main things I wanted to talk about. I don't know if folks had any questions.
Jason?
Thank you, by the way, excellent information. Back to your discussion on resiliency. I think I've always considered myself to be an extremely resilient person, but I think something that none of us in this room or in our community have faced until now is just the longevity of this.
Yeah.
And so, yeah, for a month, 2 months, yep, I can control this, I can't, control this, I can't. But after a certain amount of time, I think you know where this is leading. So I don't know if there's really a question here, but have you seen anything in your field that stands out in that dynamic, or would you have any recommendations for us as a district or families on how to kind of curb that longevity? I know that's a loaded question maybe, but to me that's what sets this apart from anything else, and just any insight on that.
Yeah, no, I wish I had a great answer for you. So no, you're right. So like there's acute stressors, or there's like an acute trauma or something where you have it and you experience it and then you figure out how to go forward. And you're right, this has been since March. I think we can anticipate that it's going to continue for quite some time yet. No, I don't have a great answer. I think, again, what you choose to focus on, I think creating structure and positive things in your life within the constraints you have right now is really, really important. So where can you get exercise? Where can you get connection? Where can you get the hobbies you have? How can you engage in them now? So it may be that you aren't able to engage in them in the same way. But you're right, we can't sit around waiting for this to stop, because if you're otherwise, you hear this kind of idea of this fatigue. And I think that's what you're speaking to. And so I think we can't just wait for this to get better, but instead, how do we create meaning and purpose and enjoyment and connection as we can now in a safe way? Yeah.
Gail?
Just, Dan, I've always appreciated the partnership that we had with the Human Service Center back in my school counselor days. If there are things that you can think of that we as a district could partner with you with, or needs that you even see for retired personnel, or things that we could do to aid, as this is a long, ongoing thing, love to reach out to you and have you reach out to us so that we can continue what has been a most wonderful partnership. I couldn't have done my job without you.
Thank
all
you,
those
Gail.
years.
Thank you,
And
Gail.
all of your great people.
Yeah, likewise. We have a great partnership, and I think it's worth having some meetings. I think it's worth talking about, because like I said, there's a population group that I am worried about, and I don't know that we're seeing them yet, and so do we figure out how to more intentionally, and what is our role as Human Service Center, as behavioral health kind of partner in the community, just to say, what can we do to kind of reach out and connect with those families and those youth in more of a preventative way, so it doesn't become that we wait to see what the hospitalization statistics are, but instead, can we intervene earlier? Because I think there are opportunities for that.
Any other questions for Dan, or Heidi?
And you did give some examples to, for parents for structure for their week. Do you have anything else that might be good tips or, some research-based opportunities that parents could take advantage of to, and I think most kids are used to a real structure before school, during school, after school, and with that being changed, just opportunities for parents to take advantage of for that structure.
Yeah, that's a good question. I would say, first off, have the conversation with your youth. Because my kids have been pretty creative and because we've sort of set the expectations, but how do we get this done? And they've kind of partnered with us in coming up with a schedule. And that's worked pretty well because they're different. And my daughter is the super responsible morning person who gets up and everything's done by 10 a.m. My son is not that way, right? So, but kind of partnering with them on what does structure look like? How do we get check-ins? As a parent, do you have ways of connecting either through your own team setup with your kid? If you're not able to come back from work, are you able to do check-ins that way? I think be creative, but I think through all of it, the most important part is conversation. Even about all of this stuff going on and just checking in with them on where they're at. But yeah, I think, and for us, and again, I have 5 kids, and so my life is, I think there's a different level of organization required just to survive with 5. But we do have a calendar where it is this is what we do at these times. And this is when you can have your devices, and this is when there aren't devices. And so that's helpful for us. And so I think about trying to think about what are those things that would work within your structure and based on your own responsibilities as a parent with work and other things you might have going on.
Okay. Heidi?
Thank you. I think that's helpful too, just pairing off what Jason said. I think I started out really well. We had the lists and the checklists and everything. Then we kind of ran into summer, and now it's just dragging on. And I think maybe the structure that we had in place, last spring is maybe not there just because of the length of time this has gone on. So thank you.
Absolutely. Yeah.
Any other questions for Dan, or none? Okay. Thanks for
Thank you.
coming.
Appreciate the time. Absolutely.
Okay, going back up to correspondence, we have B number 1, Jamestown Regional Medical Center. You want to read that, Heidi?
Okay, we received a letter from, and it's in everyone's drive as well, the Google Drive. This letter was from Mike Delphs, the JRMC president and CEO, and it was addressed to us in care of Robert Lecht. Dear Jamestown Public School Board of Education, thank you for supporting our young people and their educators during our nation's pandemic. This is a challenging task, and we are grateful for your leadership. This letter is intended to clarify several points in relation to novel coronavirus COVID-19, the school district's plan and Jamestown Regional Medical Center's approach to the pandemic as it relates to supporting the schools within the communities we serve. JRMC follows federal and state guidelines and recommendations when establishing our policies and procedures. Our sources for these guidelines are both the Centers for Disease Control and Prevention, as well as the North Dakota Department of Health. The few times these two entities are not in agreement, JRMC defaults to the advice from the CDC. We understand that the guidelines from the CDC and North Dakota Department of Health are not perfect and may feel counterintuitive. Nevertheless, the two entities represent the overwhelming accepted experts on the COVID-19 pandemic. As such, we do not second-guess recommendations. It appears that JPS follows guidelines similar to and likely originating with the CDC and the North Dakota Department of Health. The school plan has understandably produced emotion and anxiety in the community and within the school. This letter demonstrates JRMC's support for the school's plan, which is based upon advice, recommendation and guidelines from the most recognized health-related authorities during this pandemic. The plan uses these guidelines in its design and wisely avoids opinion and emotion in the school's decision-making process. In relation to the school's plan, JRMC views its role as one of support for JPS and as a resource when needed. Lastly, it is important to remind the JPS Board of Education and the public that JRMC has not sent any individual to a school board meeting to speak on JRMC's behalf. Any views or opinions expressed by anyone mentioning JRMC are their own and do not represent the views, policies, or opinions of the hospital. Thank you for your leadership in this difficult time. Sincerely, Mike Delfs, JRMC President and CEO.
Thank you, Heidi. Moving on to reports, we have superintendent report. Rob?
Thank you. You have my written report. I'll run through some of these areas a little bit more in depth than others, just because some have action items or information items later in your agenda. In terms of the community input session and board retreat, as you're aware, we had some conversation about it earlier as well, but there was some changing guidelines related to close contacts. And because we were anticipating that change coming, we were waiting to have our next instructional plan stakeholder team meeting. That has now moved to tomorrow. And so we're going to have that conversation to see how the impact of this changing definition does it impact our instructional plan? And if so, to what degree does it impact? I mean, I can say that it was a primary concern for us as a district, how close contacts and just the volume of potential exposures and led to quarantine. And just to give an example, in the second grade, we know that these are young students that have a very difficult time distancing and even creating pods of learning. It's very difficult to say there has not been 15 minutes of exposure time, within that 6 feet guidance. So prior to this, we likely in a first grade classroom, a kindergarten classroom, a second grade classroom, would have had to quarantine the full group. All 18 second graders and their teacher, and probably some support staff. This does change that fairly substantially. If we are now removing one positive student and continuing to keep the other in monitoring, of course, there are the expectations or the requirements of masks. I provided an infographic later in your agenda as well that I think does a nice job of explaining the difference and how that change occurs, or what that change really means. So there's other factors, though, that are beyond close contacts. That wasn't the only reason why we had made that instructional plan choice. The team is also going to have to look at the number of contacts, transmission rates, what our county designation is, what we are looking like, what are our trends. So there's a lot of factors beyond close contact, but this is a big piece of the puzzle with close contact. So it certainly is going to be a topic of discussion when our team meets tomorrow. But in any case, we wanted to hold off to scheduling this community input session until we had a good chance to understand what those guidelines were going to be. We had an idea, but we didn't really have a clear sense about what, usually as superintendents, we find out at the same time everybody else does. We don't get pre-notice. We had some conversations, made some recommendations, but that doesn't mean that's what's going to happen. And so we wanted to wait until after to look to schedule this meeting. So the community input session, what we're really thinking about, one of the other challenges we saw is trying to find a date. There's conflicts consistently, whether that's with activities that pull board members away or Wednesdays and family nights and things like that. We wanted to be cautious about what day. Ultimately, what I settled on was doing it on Monday, the 19th, after our next board meeting. You've already blocked out that period of time, or at least that evening. And if we can have a truncated agenda that can be from 5:15 to about 6, and if we can do that meeting at the high school, we could then have that meeting in the Commons area in the high school. Of course, there's a concert that day, so we might have some things to work around there as well, but that might actually encourage some more input gathering as well. So we'll just have to work out how that might work. But that's the plan, Monday, October 19th from 6:15 to 8:15. We would have a virtual option for those that don't feel comfortable as well. After that, then we'd look to schedule a retreat. We just, again, have to find a date that works for everybody, and then we could review those perspectives, share it at the input session. I did have an agenda item, or there was an agenda item on education for core funding, and I did have a memo that I'll touch on a little bit more when we come to that piece later in the agenda. With the virtual academy, that's continued, honestly, to be a little bit of a struggle. I think we have some families that love how that process is going. They love the experience. Others are ambivalent, and others are struggling. Originally, our intention was to ask people to commit to a semester long. That was our original intention. How things have gone, I really believe strongly that, and that was validated. We had an administrative team meeting this morning, and I asked that, and it was consensus at that meeting as well to open it up at the quarter. So if there's those families that are saying, boy, this isn't for me, this wasn't the choice for my child. Yes, we incur costs because we're paying for that for the year. That's what the plan is through Arizona State, but I think it's in the betterment of kids. We've targeted CARES dollars for that expense in any case, and that's my plan is to open that back up for those families that are choosing, boy, we want to be back in school. Maybe it wasn't what we expected, or it was maybe my student is not a great online learner. Maybe it's too much for us to handle as families for whatever reason. I think that makes sense. One of the other areas that we've seen a real struggle in is in math. Our secondary administrators proposed that we could use some peer tutors or maybe some tutors from the University of Jamestown. They're seeing the biggest concerns in math at the secondary level. And so that's one of the areas with the education core funds that you'll see in that list of proposed activities as well to target math. You have a question, Mr. Rohr?
And the students will still get credit for first quarter through? Okay.
Well, and that's why we'd want to do it at a quarter break. Really, it's no different. I was using this example earlier when we were talking to administrators. It's really no different than when a student comes to school in Jamestown and transfers from Belfield. We don't, we look at the course that was taken, we take it at face value. We don't dig into what standards they taught in Belfield and in that quarter. We accept what's been provided to us. That's a little different at the high school level when they're receiving credit, but it's a known issue, and it's something that they're looking to see. The bigger issue becomes if very little work has been done. That's where the challenge is, and hopefully those are all areas that we've addressed through progress monitoring, but that's the bigger challenge. Other questions with the JVA?
Diane? No. Melissa, you have one?
First of all, thank you for the option for families to be able to opt out of that earlier, because I've heard a lot have struggles too. And then my question would be, if we have some families that are opting out and there's some who decide that they would like to opt in, are we able to swap out any of those at all, or would that not be an option?
Well, at this time, I would continue the same belief that we initiated this procedure with, that you had a window, knowing that instructional plans were going to change, things were going to change, people had an option to opt in at that time. Because for every one of those, we've entered into an agreement with Arizona State for these courses, for these licenses, for these students. I think opening it up again would be problematic. So at this time, I would say no. Of course, you never say never, but I really think that would be a challenge for the district, and especially with what we're seeing. Yeah, and I don't anticipate anybody going to opt in. Yeah. But it's just one of those things, we're hearing our families, and some are, and like I said, don't get this as it has not been successful for some. Some really enjoy this, the virtual option, and it's been great for some families. And the other concern, I actually just answered an email from a family on this today. The concern being, will this not happen all year then? No, it's still an option regardless of if you are in as long as quarter break, semester break, or the year. It's going to be the option for the family. As a district, we've already made that commitment. So that would maintain, it would just be another option to come back into the school setting at the K-5, middle level, or high school. I touched on instructional plan discussions. If there's any further information people would like on that, that's something that we're meeting with this week, and we're going to have some conversations and see what variables, with the variables that have changed, does that impact instructional plans at all? I will continue to reaffirm that if we do make a change, either more restrictive or less restrictive, that we'll provide ample time. There's various checkpoints that we're going to look at if we make any changes. Likely at a quarter break or semester breaks, things like that. There's natural checkpoints that we would probably look to if we're making a change, but be ample time for people to prepare.
Diane, do you have a question?
Well, I've always said we're very fortunate that our superintendent has his ear to the ground and oftentimes knows what's going on around the state, so before others do. And I'm wondering what you're hearing about this change in protocol from other districts and other superintendents.
I would not call it a game changer, but it's close to that. It does provide a significant, one of the variables of large groups of students being taken out of the school setting for 14 days, potentially teachers. When that is removed, that is a pretty significant factor. It is, and it's something that the team has to look at. Like I said, it's not the only factor, but it is a fairly significant one. And I think, like I said, other areas that we need to look at is total numbers, trends in our county, trends in our school, total numbers of positive, total numbers of close contacts that we've already seen, the transmission rate, meaning how many students that have left due to quarantine have become ill. And there was actually a survey done across the state, 150 school districts, to look at the transmission rate. So that's data that the team was going to have to look at and say, and some of those 150 schools are more restrictive than we are, and some are less restrictive than we are. So I think we get a pretty good sense of what we could expect. Because we can't just look at our own school in a vacuum, because if you change the variables with masks or distance or the hybrid, the amount of students in it, that's all going to change. So you have to have some kind of metric to look at. And I think those will be good, interesting discussions this week. So hopefully we have good discussion there. I've also invited to that meeting Mr. Gaylor and Mr. Hardy as well to gain their perspectives on how, if plans change, what would have to go into place at those individual schools as well, if that did become less restrictive, just to help give the team a real sense of what would have to happen if all of those factors point towards a plan change. So I can't speak for the team. They have to, we have to have that discussion as a team. And but I'm looking forward to the discussions. But no, I to answer your original question, Diane, I think it is a pretty significant variable. Absolutely maintains masks to be worn in the proper way, though. I think we have to look at what the guidance says about masks, not just that we have them, that we're wearing them properly, and that that's a big factor too.
Gail?
My question was along that line. If that masking is that most important contingent part of this new guidance?
Say, Gail, can you talk into the mic so that we
I'll
can
move
pick
it
up on the mic here?
I'll use my outdoor voice.
There you go.
I taught as a teacher a long
There you
time. I
go.
can project it, but I don't want to aerolize. So, how will that be enforced? Will that be up to the individual teachers if they have someone who's not doing that? How will we deal with that? And would something come back for our approval if it does result in a major change in how instruction takes place?
So the way the plan is written, that team determines instructional plan. You've approved as a board the instructional plan designs. The team is empowered to make the plan choices. So that includes teacher, local health official, school board member, myself. That's the team that looks at the actual plan, the instructional plans, and makes the determination. We've been very fortunate as a district, I think, moving towards expected in green resulted in a high number of students wearing masks every day, and it's become the norm. Even in expected, I would say it's been about 98% across the district. Of course, required is different. That's 100%. But we've been very fortunate. The plan design was created expecting the potential to go into yellow. And so with an expected mask, with a mask expectation, that's been a blip on the radar screen. We've been able to make that transition really pretty easily. And with this regulation change, it's not going to be a heavy burden at the school level for students, for families. It's basically what we're doing now. And so we can implement different quarantine procedures or different close contact procedures because of that. And so we're taking fewer kids out. And the reality is we aren't seeing a high level of transmission from students that are home in quarantine are not getting positive. We're not seeing positive from those students. So it makes sense. And that's consistent with what's happened and what's been seen across the state. That there isn't a high level of transmission for students that are in quarantine or staff that are in quarantine. It's about 1% across the state. Other questions on that?
Heidi?
I just wanted to kind of reinforce some of the things that you're saying based on some of the correspondence we've received and just conversations with people that we do have a team. We do have a team that's evaluating things ongoing, and we also are working with our local health officials and getting all kinds of data. It's not just one piece. It's lots of pieces, and putting the picture together of what's going to be best. So I just kind of wanted to reiterate that just because I think I have, people stopping and talking to me, and, I hear from one end of the spectrum to the other. Some kids are doing great in what we're doing. Some families feel their kids aren't doing as great. And I think Dan had some good points also to kind of help us, but I just wanted to kind of reiterate the team is meeting, and you held off a meeting based on some new data that was coming in and changes from the governor.
Well, and it's true. I mentioned this a few different times. We really do get every end. We get both ends of the spectrum. We get a lot of people right in the middle. We get a lot of people that say either we like what you're doing or you're not doing enough, and we get others that say you're doing too much and it's too restrictive. The vast majority of people, I would say, when they reach out to me or stop me in the grocery store or whatever it is, say thank you. Most are thankful that we're taking it seriously and that we're, no matter what their personal preferences are, they know that the procedures we've done are good, that we're looking out for kids, and they appreciate that we are taking it seriously. Now, that doesn't mean that everybody, like I said, everybody's on both ends, and some people say we should be all virtual. Some people say we should be all in all the time. We get them both. Like I said, we get a lot of people in the middle too. But we do hear from all sides. We take all of those perspectives into account when we made the plan. Other questions on that? I was asked to update on the Clorox 360s. If you remember, those are the electrostatic cleaning machines. We actually purchased we sent in an order I can't remember if it was March or April, May. For those, they come in slowly. As you can imagine, every school district, every organization, entity ordered these machines. We have all but 2 in place. We purchased 1 for every building. We have all but 2 in place now. So those that don't have it, they're sharing with the other buildings when they need to. I will say they did my office. I wanted to see what it looked like or how quickly it operated. It did my office in less than a minute. So it's really pretty quick. I know that staff have used it. There's some staff in some buildings that have used it to disinfect, play centers or whatever. And it's very easy to use. A little heavy for those buildings that have stairs to lug it up from one floor to another. That's a little bit problematic, but it's certainly possible. It's been a very good machine. I think it's a very useful. And one of the things I like about this machine is, I think I mentioned before, is that this will, once we are past the COVID-19 crisis, this will still have use for our district in flu season, just disinfecting in general. I think it's a wise purchase. I wanted to bring the board awareness to Amazon Smile. You may not be aware of Amazon Smile, but it is a foundation. Amazon has a foundation that provides part of whatever you purchase or a percentage of whatever you purchase on Amazon to various entities. If you look on the Amazon Smile website and search for Jamestown, you can see there's a number of different ones that you could be donating to through online purchasing. That includes Jamestown Dollars for Scholars, although that's listed under the foundation. PTOs, I know Gusner Elementary is under there. Activities such as Sophistikicks, hockey boosters, there's lots of different opportunities for you. I will say though, just a reminder that you have to actually log into Amazon Smile. You have to make that designation and choose which nonprofit you'd like to provide that to. If you just go to the regular Amazon account, you see no benefit or nobody sees a benefit, even when you've registered. You have to go through that Amazon Smile website. And I'm just providing this as, I think anybody that uses Amazon should be giving to somebody. Use that website because if you're going to make those purchases anyway, you might as well support some nonprofit, some entity in town. It doesn't have to be a school one. I have opinions on those, but there's lots of different places you can give. And it doesn't just have to be here, but I think you should be giving somewhere. And just a reminder, so for those that maybe just don't know about it. But of course, I'm not advocating all of your online, that you all do all purchasing online. Of course, we have a ton of local businesses that support our school as well. And I'm just making you aware of the online option if you're using Amazon already, that's something. But of course, we advocate for local purchases and supporting our local businesses as well. I don't have any EBS license updates for you. Just wanted to pass along as well our CARE. We did receive some more funds from CARES. That's our broadband financial assistance CARES package. So that's about $8,500 that we are using to support those families either in the JVA or otherwise that don't have access to broadband services. So we're providing that for them if they need it, and we're paying for it through these CARES funds. One quick last update, it is National Principals Month, so make sure that that you do recognize your building principals for the outstanding work that they do. There is a time, I've used this before, I used this statement before, but I will tell you that crisis exposes leadership. And I think what we've seen in the midst of crisis is really outstanding leadership, not just by principals, but by our teacher leaders as well. But in National Principals Month, I just want to recognize the outstanding leadership that those individuals have brought to our district. And we certainly couldn't do it without them, and I just want to recognize them. With that, it's time for other questions.
Melissa?
Going back to the community input session, I realize that there's in their guidelines is that there's an administrator at each of the tables, and I realize that is protocol to have the chain of command there, but I would like to request that we have one table that is free of an administrator so that staff and faculty would feel comfortable expressing their opinions.
Aaron?
Just a question on how this input session is going to be communicated out to the community.
We'll put it out through our app notification system, emails. That's how we'll communicate out the dates and time. Once that's, now that I have presented it to you with my intention of not hearing a conflict with that date, then we'll get it sent out this week.
Jason?
Were we still planning an electronic option for, okay.
That's what I was going to say, Melissa. I mean, if someone doesn't feel comfortable, because that's going to be manned by, Gail's going to have one, I think, and Greg, and so there's going to be no administrator there. So they can just call in and do that, so. Any other questions for Rob or on Heidi?
I just want to make sure we're saying the same thing. It's my understanding that will be a Zoom link, and then
Yep.
there's a link to fill out. So I just want to make sure, you mentioned call. I just want to
Yep.
make sure that we're saying the right information, that it is a
Correct.
Zoom link. Okay.
Thank you. Yep. No other questions for him? Moving on to Board Education, we have the tuition agreement and open enrollment. Rob?
All right, you can get to listen to me again.
Yep.
I think it's important that oftentimes in every board meeting, you act upon tuition agreements, open enrollments, and I just wanted to provide some board education so we understand what they are, when we see them, why we might see them, and some different areas that the board should consider when you do have tuition agreements and open enrollments. So open enrollments are allowed by North Dakota Century Code 15.1-31. And essentially, these are agreements in which families choose, they're making the choice afforded by law to them to attend a public school outside of their district or residence. They complete the paperwork. One of the things that's probably important for a board member to understand about open enrollments is when they're approved in perpetuity. It's approved one time. That's certainly a difference between tuition agreements. They're in a tuition agreement, that's would have to be done every year. That's an annual agreement. An open enrollment, if you're staying in that district, if a family moves from a student in Jamestown moves to Pingree Buchanan and that open enrollment is approved, if they stay in Pingree Buchanan, they don't ever have to do that open enrollment again. It happens in perpetuity. If they move or if they change, if they decide, well, Pingree Buchanan isn't for me, I want to try Medina, we would go through the whole process again. So if they stay in that district, it exists in perpetuity. There's a deadline of March 1st. That timeline is important for board members because you see a lot of open enrollments either coming in or leaving at the same time of year. And it looks like a long list of people. Well, sometimes these agreements we've had in place we've had these forms for 10 months and we're waiting for the deadline. For us, when we approve, sometimes tuition agreements are bridges to open enrollment. So if somebody comes to us and looks to move to another district, we might bridge that open enrollment with a tuition agreement. So very often, you're going to see a tuition agreement, say in May. We ask then for them to complete an open enrollment as well. So you see that tuition agreement, then you approve in March an open enrollment as well. So sometimes it appears that tuition agreement, we look at all these, we have all these tuition agreements and all these open enrollments. Sometimes it's the same families moving from one agreement to the other. And I think that's important to be aware of as well. So with open enrollments, we provide open enrollments for resident students in the consent agenda. We do that for awareness. It does not require board action. It's allowed by law. It used to be that way. It used to be that both districts had to approve those. That changed probably 10 years ago, where that was no longer required for the resident district to approve that, just the admitting district. We still approve them because we think it's important for you to be aware of those open enrollments. So I get the question asked a lot, are we able then to deny open enrollments into our community? The answer to that is yes, but with caution. You can never discriminate against anybody. You could not say, well, we have open enrollment for you 25 kids, but not for you, because you're a high need special need. You're a high cost special needs student, so we don't We want to discriminate against that family, or you certainly can't discriminate ever. I think that goes without saying, but you can never discriminate, so you have to make sure that your open enrollment practices are consistent. If you're open, you're open. That means you accept all. You may put in place some kind of governors to say, boy, we're closed at this level, or we're closed in this area. You might be able to make designations there, and then you're not discriminating. You're looking at the resources that you have, and you're making a decision for all in that area. But I would just exhibit caution. If you're open, you're open. If you're closed, you're closed. But I do get that question quite a bit. In terms of tuition agreements, those are contracts between school districts. They're also allowed by North Dakota Century Code 15.1-29, and that allows you to educate a student outside of the district or residence. It does not have a timeline. It can happen at any time. Like I said, oftentimes they're a bridge to an open enrollment. Tuition may be charged. A district may choose to simply accept tuition, or to waive tuition, just accept the foundation aid amount for that student, which is in most cases what occurs, unless there is a high needs contract that goes in place. Because those are either a waiver or a exchange of funds between districts, because of that, it's an approval is required both from the admitting and the resident district. What we, one of the things that, just to go back to this point, that I think it's really important for the board to remember, there's a lot of circumstances around why families choose these options. Open enrollment. We hear pretty consistently from families things like, our child care is in Medina. My grandparents live there, or my parents live there. That's who watches our students after school, so we want them to ride the bus and go to Medina. I'm from there. I want a small class sizes. That's important to my family, so they make that choice to open enroll. Another factor that's really important for the board to understand is that whole process can start over again. As the example I gave before, if a family goes to Pingree Buchanan, they go through a tuition agreement process, they go through an open enrollment, and now they're in Pingree. After 6 months, they decide, boy, this isn't for me, and I want to go to Montpelier. The whole process starts again. So you could see, and we have seen, some very familiar applications from year to year. And like I said, sometimes it can appear that we have a lot, and sometimes it's the same family, or the same families making different choices that they certainly are allowed to do. But I don't want it to give that illusion that more is happening there than it is. Another reason why we've heard a lot of why families make the choice, I'll just give you an example, a real example. Family has gone to Montpelier, their whole lives lived in the Montpelier School District, have gone to Montpelier, moved to Ypsilanti. Ypsilanti is in the Jamestown School District, but they want to, because their child's a sophomore, continue to go to Montpelier, because that's where they've always gone. They would have to fill out an open enrollment in this case because they moved. So there is open enrollment waivers. Those can be acted upon right away. So if a family moves open enrollment, you could complete that right away. You wouldn't have to do a tuition agreement. But that's a family that's always been in Montpelier, wants to continue to go to Montpelier, so they fill out an open enrollment waiver so they can do that. But I guess at this time I would stand for questions if you have any regarding tuition agreements, open enrollment, the process, the procedures, rationale for why.
Any questions for Rob? Or? I just have one comment that if a person, they'll do a tuition agreement, if they don't continue into that open enrollment paperwork, they're doing a tuition agreement again the following year. So that there's some that don't want to go through that process, so we're always seeing that continuous. The next year they'll have another tuition agreement. So
usually that happens if they're moving from district to district. Amy does a really good job of managing. She's a taskmaster. She makes sure that if we get a tuition agreement that we get an open enrollment too. Okay. So we're not looking for that again. I can't say we have a 100% hit rate on that, but she does pretty good. But more often what we see is the tuition agreements from just moving, starting the process all the way over again, moving from Pingree to Barnes County to Medina, wherever. But that's what we see a little bit more often in terms of the same families.
Okay, any other questions for Rob? None? Okay, moving on, we have nothing under old business, new business, nothing under activities. Moving to building and grounds, is there a motion to approve the gymnastics agreement? Motion by Gail, second by Heidi. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into.
Hey, Roger, could I just
Oh, yeah.
Could I just provide an update? I did have some questions related to this agreement, and I think if you've gone by Casey's, you see that there's quite a bit of construction happening over there, and how does this agreement impact that? The answer is they're anticipating that well, two things. Number one, they need a place to practice regardless, and so they will incur costs to practice wherever, but they do anticipate that location would be completed prior to season starting. So just wanted to pass that along in case that question came up in others' minds, because I did have that question.
Okay. We have nothing under curriculum and assessment. Moving to finance, is there a motion to approve the innovation grant in the amount of $3,500? Motion by Aaron, seconded by Gail. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter B, is there a motion to approve the proposed education co-op activities? Motion by Gail, seconded by Melissa. Any discussion? Do you have any comments there, Rob?
Well, I just wanted to comment, to reaffirm discussions we've had in the past, and also for the public. These are CARES dollars that have come to schools. There are some pretty limiting restrictions that can only be used for personnel, which is why you see that our proposed uses. What we're looking at, the only thing I would maybe add to this is behavioral health. If we're seeing some behavioral health challenges, that might also find its way into these dollars, because I think there is a need there. So if there's an opportunity we have that we can find, that might be something that I would ask that you add to this list as we go through. But the other limit to this, outside of that it can only be used for personnel, is it can only be used on expenses through December 31st. It's October 5th, and the package is $500,000. Very challenging in a school setting to expend that. I think we have some pretty good plans here, things that could impact students right now, things that could impact the district long term. We have opportunities to repurpose some staff that I think are important in terms of reimbursement. But it'll be a challenge to, unless these restrictions are either lifted and we can spend it on more, or if it's extended beyond December 31st, but we will do our best. It's just limiting, and I just want people to understand that these are CARES dollars. They're not the ESSER. That's an additional set of dollars, but I think there's some good opportunities here as well, and we certainly will do our best.
Heidi?
Are the restrictions coming at the state level or the federal level or both?
It's a great question. Both. The restrictions for so what you have to think about is the CARES dollars come from the federal government. So the federal government has the restriction of the December 31st, 2020. So that's where their restriction is coming from. If you remember our ESSER funds, and we had a pretty broad swath of activities we could do under ESSER, those still exist. It was the Emergency Commission, it was our own legislators that said, we only want to spend it on personnel. And so that's where the personnel restriction comes from. So we get one really challenging restriction from the feds and one challenging restriction at the local level. I will tell you, we have, as administrators, we have testified, and we've asked for more flexibility with the Emergency Commission. We are asking our own legislators to push for more flexibility so we could use those on other areas. I think we can all understand that there's huge needs in a pandemic outside of just personnel. And I think we could use those funds better if we had a little bit more flexibility, but right now, we're operating under these kind of restrictions. So this is the plan that I have for you, and it's October 5th. I think we need to get moving on doing some of these, especially as it relates to personnel. We have to post, we have to find people. It's already going to be a challenge. Probably the thing I'm looking forward to the most is and I provided a link to it as well, an opportunity for our staff to create and upload content to our learning management system. I think it's a great opportunity to honor the teachers that are likely already doing some of this work. And if we can use these federal dollars as a way to recognize the work that they're doing, I think it's a great opportunity. Completely voluntary. People can say, no, that's not for me, but I think this is a good one.
Jason? Question? Okay. Okay. Any other discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into number 5, we have personnel. It's there for your information. It's the student superintendent evaluation timeline reminders, just to make sure that we have all our evaluations in. And if when we get to the end, I think, Amy, if some of us are short, you'll be notifying them on maybe, yep, okay.
If you remember my reference to a taskmaster earlier,
Yeah, that's her
she will
task
help
too.
you stay on task.
Moving, what's that? What's that one?
Our letter of resignation, I added that to the agenda. I don't know why that. Yeah, he was on the agenda. We're having some issues. So thank you for that. I did send out the agenda, and that's the agenda that we posted. I just updated here and I missed one, so I apologize.
That's right, it was on there.
Agenda I posted did have a resignation, so thank you for that reminder.
Did everybody see that resignation? Is there a motion? Heidi?
I make a motion to approve the resignation of Mary Lionheart and thank her for her years of service with the district.
Okay.
For science.
There's a second by Jason. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into number 7, tuition. Is there a motion to approve the 7th grade Jamestown student to attend Montpelier Public School for the 2020 school year? 21. Motion by Gail, seconded by Melissa. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to B and C, is there a motion for the tuition agreement for a Jamestown kindergarten student and a Jamestown 7th grade student to attend Pingree Buchanan Public School for the 2021 school year? Motion by Gail, seconded by Melissa. Any discussion? Oh, not Diane, excuse me, not Gail. Any other discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter D, is there a motion to approve the tuition agreement for 2 7th grade Jamestown students to attend Medina Public School for the 2020-21 school? Motion by Gail, second by Jason. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter D, is there a motion to approve a tuition agreement for a 6th grade Gackle Streeter student to attend Jamestown Public School for the 2021 school year? Motion by Melissa, second by Aaron. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to items for future agenda. Heidi?
I'd like to have the board invite Jim Rolson to come visit about fall activities during a pandemic. I know some of our activities are wrapping up, and others, like football, hopefully we have a long postseason run, and so it can be next month, and that's fine.
Okay.
We're also having some choir concerts and things like that, too, just maybe talking about our processes and procedures as well as what's happening within the activities.
Okay. If there is something that comes up, just let myself or Rob know, and we'll get it on the agenda. Moving on to meetings to be scheduled, we have the District Technology Committee meeting on Thursday, October 8th at 4 p.m. We have the North Dakota School Board Association Delegate Assembly. It's October 30th at 3 p.m., and it's to be held virtually. We have the North Dakota School Board Association new member seminar on October 5th, 9th, 13th, or 15th, and that'll be held virtually also. We have the Health Insurance Committee Monday, October 12th at 3:30 in the Central Office Conference Room. Our next school board meeting will be October 19th, 5:15, possibly up at the Commons area?
So the plan would be to do it up in the library.
Oh, in the library, okay.
So we'll notice that.
Heidi?
I just also want to note that the SCEC, Southeast Education Cooperative, has scheduled their governing board meeting this Wednesday, October 7th at 11:30. That is meeting on Teams, and the information should be on their website if people want to
Okay.
attend.
Okay. And then the last one is the North Dakota School Board Association Law Seminar will be October 26th through the 30th, and that's also held virtually. Roman numeral 6, remind everybody to right-click on their superintendent evaluation, complete that, and then also to right-click on our adjournment to assess our meeting. No further business, meeting's adjourned.